a few guests on the call today. We're going to share a little bit about what's going on with our support regarding the opioid crisis, a new fentanyl letter that's been drafted to send out to families. I have some members of our data team here to share a little bit more in-depth COVID-19 data with you, and then we'll wrap up the meeting with a few updates to our monkeypox process as it pertains to schools. First announcement is we have a few QPR trainings coming up next month, and our team here is giving priority spots to school staff. So if there's members of your school that would like to be trained in the QPR model of suicide prevention, go ahead and have them sign up. These spots are limited and we anticipate that they'll fill up pretty quickly. So wanted to make sure that this news was shared with this group first. We also have some monkeypox resources that we drafted specifically for teenagers. Really just want to educate them on what monkeypox is, let them know they don't need to be scared about this. They're not particularly at risk because this is still considered a rare disease, but they might be asking about it. And if your school would like hard copies of these resources, we do have posters that we can print for your schools. We have flyers, and then we'll have a social media post. All this will be sent out in the follow-up email, but please shoot us an email if you would like to pick up hard copies of these resources for your school. And we're also working on Spanish versions of these resources as well. And those will be coming soon in the next week or two. Also just wanted to let you know we have some vaccine resources in the works. So tips for talking to parents about vaccines, how school leaders can continue to promote vaccination, and then a template letter for schools to send home with families about vaccine opportunities. And so these are all being put together by our vaccine equity team, and we hope to have these out in the next couple of weeks to everybody. That's all the announcements I have. I'm going to turn it over to our first presenter. I do want to mention, since we are kind of short on time this morning, if everybody could utilize the chat for their comments and questions today, that'll be helpful, and we'll try and get to all of those as we see them in the chat. So I'm going to stop sharing, and I'm going to introduce Mark Person from our Community Mental Health and Addiction team.
All right, morning everybody. I wanted to first just introduce a letter that went out yesterday. Some of you may have seen it, some of you may have not, but I'm going to share my screen just so as I talk about it, you have a visual on this as well. So this is what the letter looks like. It went out this week, and so like I say, it's probably making its way around to folks depending on what you do for the schools. You may not have seen this yet, but this is the second installment of a letter we sent out last year too. So if you recall last year, the reason we sent this letter out was really for this reason right here. We noticed rather quickly that fentanyl overdoses were increasingly more common and really growing at a rapid pace. And what happened in 2021 is fentanyl became the leading cause of death for teenagers in Pima County. I'm happy to report this year that those trends have slowed down. We're still seeing these deaths in these age groups. Hopefully the pace continues to slow. Time will tell. We still have some months left in the year. But this is the reason why this is so important. We have, you can see for teenagers right here, unintentional injuries are the leading cause of death. Intentional self-harm or suicide is the second leading cause of death. Assault and homicide is the third leading cause of death. So when we look at these age groups, we really try to put out information that may assist or support what you guys are doing. And because unintentional injuries is up here, the reason that's so high is because of accidental overdoses. These aren't necessarily related to car accidents or accidental shootings or falls or stuff like that. Those things happen. But it's the accidental overdoses that are really pushing this forward. So the letter itself looks like this. There's a couple things to be aware of. I think most of you have heard about fentanyl and how potent it is, but this is really the intent of this letter is to raise awareness about fentanyl, what you need to know, what it looks like. If you're a parent or guardian, what do you need to know? If you're a teacher or administrator, what do you need to know? And how is this impacting kids? So I just talked about how it's impacting kids. There's a lot of fatalities from it. And there's also a lot of hospitalizations. So those non-fatal overdoses that occur, we don't report on those, but we are seeing that trend continue every month. And we've seen this year specifically some overdoses that have occurred in the school setting as well. So that's obviously a little bit more concerning. I know we've got Narcan out of the schools now. And a lot of behavioral health resources are starting to kind of trickle down as well. Hopefully those things will start to take hold and help where needed. But the primary purpose of this is for you to share it with staff internally and also hopefully help us push it out to parents, guardians, or foster providers as well. You may or may not have heard recently that any licensed foster providers in Arizona are now required to carry Narcan or to have it in the home for each of the foster children that live there. We are working on getting those folks taken care of as well. So a lot of things underway, but the big changes from the last letter really are about the rainbow colored fentanyl. You might have seen this in the media, but this picture that I'm circling around over here is an actual image from drug seizures. So this is what they look like. Above that is the blue M30s. Both of these are fentanyl, and this is the most common form that we're seeing, but these ones here are growing a lot more. And what you want to be aware of is the DEA recently put out a notification warning folks locally that this coloring, the candy-like appearance, may unintentionally draw kids to the table, and we may see more of these overdoses as a result. I haven't seen that yet, but I do worry about it because there are three different kinds of overdoses. There's intentional overdoses that are related to suicides. There's accidental overdose for people who are just using recreationally or have a substance use issue. And then there's unintentional ingestion. So like a young child that picks something up and eats it and not knowing what it is, and then they experience an overdose. That latter example is the one that I worry about the most with these multicolored pills, because we already see those cases with the blue M30s, and there's a real potential because these look like, sweet tarts and things like that, that they could be attractive for kids to pick up and eat. So that's one of the bigger updates on this. The resources at the bottom are still all the same. All the information is here if you need to get a hold of us, if you have questions about the data or what resources we can offer, or if you need to be connected to some of the providers in the community and you have questions, we can help support that. The letter is in English at the top, Spanish at the bottom. So if you print this, you can double side it. So it's just all on one document. And I think I'll pause here just to see if there's any questions, because I know we have a real limited amount of time. So let me go ahead and pause. And I don't know if anything came through the chat, Matt, or if folks want to speak up.
There was just one question in the chat of how this is being distributed, specifically who should this letter be given to? Are we hoping to get this out to principals at each school, or should this be something the health staff helps disseminate?
I'm hoping everybody will. This is one of those examples where I'm fine with duplication. I know it kind of sounds like you might be spinning your wheels, but we want this to go out far and wide. Parents, guardians, administrators, principals, teachers, health staff, and everyone should be aware of this stuff. Again, this is the primary risk in our community for our kids right now, and we're seeing a lot of harm. And the more people that know about this, the better. So really, as much support as you can give us in sharing this information, great. If there are questions or follow-up, please, you can forward all that to us. We'll take that burden on so that you're not stuck having to answer questions or respond, or we're even willing to come out and address questions in person if need be. So yeah, please share far and wide. Any other questions?
Really quick, Mark. Oh, sorry. I'll let that person go first.
Just real quick, has the letter already been sent out to schools, or if we wanted to get a copy of that, is that going to be a printable version in the after meeting notes that you send out?
Yes, I'll send a digital copy to Matt so he could share it with you guys as well. But yes, it did go out. And I believe it's even actually embedded on our website. So, but like I say, I'll get it for the purpose of this meeting and the group here. I'll get this to Matt so he can share it with you guys because it's fully published and ready to go.
I looked it up on the health department, the Pima County under fentanyl, and it just has the old one. So it wasn't updated yet.
Communications may not have got that up on the website yet. It will be though.
Thank you.
Yeah.
Mark, is it okay for folks to use this as a template and embed their own logos?
Yes.
Yep.
We're fine with that as long as people aren't altering the the content and the messaging on it. We're fine with people kind of adapting or sending it out to their distribution lists and putting their logo on it. That's fine. Question about naloxone. Many of our schools have access to naloxone on campus. What do we tell concerned parents who would like to have access to naloxone at their house? We can obviously supply that for free out of the health department. So if there are families or foster providers in need, you can forward them our way. They can also go to pharmacies in town. Some of them you may have to pay out of pocket depending on your insurance. If a child is on Medicaid or CMDP funding, they can use that to cover the cost of the Narcan. And I believe if you're a licensed foster provider, you can get it for free from the pharmacy as well. But we can take care of people. Our library locations have it, and you can also link our distribution map to folks as well if they have questions.
And Mark, do you quickly just want to outline if schools were interested in having a presentation for either their staff or their families, what do you have to offer and how would they arrange for that?
Yeah, we can do one of two things. We can offer one of our, the standard curriculum that we go through. So there's a lot of different programs that we can facilitate. One of them is RX 360, which mainly talks about the kind of the dangers of opioids and what services are available, things like that. We have a rising fentanyl presentation that focuses primarily on fentanyl and opioids, but talking about all of the risk factors that are known to that and services and support that's available. And then we can offer just sit down Q&A sessions. We can talk to them about the data. If people want to understand the trends and how significant this problem is, I can do a full presentation with our interactive data dashboards to show folks kind of how these trends have changed over time to help sort of establish the severity, and then have a Q&A at the end so we can kind of customize it as well. So if any of those things sounded remotely of interest or applicable to you, please reach out and we'll be happy to do that. And it looks like Matt's sharing a map of the distribution sites for us here, so that's awesome. Thank you. I think that's it, Matt. Looks like we're good to go to the next. If there's any other lingering questions after this, shoot them over to Matt, please, and he'll forward them to me, and I can follow up afterward too. But thanks for the time. I appreciate it. I know you guys are on a tight schedule this morning, so thank you, and have a good rest of your day, everyone.
All right, thank you, Mark, so much for presenting. Also, as with the monkeypox guidance, if schools are interested in hard copies of that letter, I'm sure we can arrange to have some printed for schools to pick up. Not quite sure the preferred method of getting information out, but if you're still sending hard copies home with families, I'd be happy to help print some of those out for you. All right, moving on. Do we have Emma on the call?
We do. I'm here. Let me share my screen.
Hi, Emma.
Good morning. All right, hopefully you guys can see my screen. I'm just going to briefly go over some COVID-19 data pertaining to vaccinations for schools and school districts. So looking at our vaccination rates, this data comes from ADHS directly, specifically MedSys. So MedSys is our disease surveillance system for the state of Arizona. We receive this data weekly, and it comes in predetermined age groups, which you're about to see. So looking at age group less than 5, our incomplete series is at 41.5%, and our complete series is almost at 60%. Looking at age group 5 to 9, incomplete is at 25.4, and our complete series is at 74.6. Those who do not have a booster is at 90.21%, and those that do have a booster is almost at 10%. Now looking at age group 10 to 19, 20.6% have an incomplete series, and those that do have a complete series of doses is almost at 80%, which is really great. Those who do not have a booster, 77.01, and those that do have a booster is at 22.99%. And you'll know that the complete series is higher in both age groups here, but the no boosters category is lower. Now looking at vaccination rates pertaining to school districts specifically, this data source is our COVID-19 vaccinations in Pima County, Arizona dashboard, and the dashboard uses data from ACIS. ACIS is the Arizona State Immunization Information System. It's our state's immunization registry. So this pie graph just breaks it down based on the cumulative school district doses, which you're going to see in the dashboard momentarily. 53% have received their first dose, and 47% have received their completed series. So this chart lists all the school districts. These are the school districts that are listed on the dashboard that we're about to look at by first dose and completed series. I'm not going to go through every single one because you have access to these slides and also the links. So overall, Pima County community level is low. This figure that you see here is from the CDC's COVID data tracker website. The link is provided below. Super helpful website in case you would like to use that for your resources. And overall, just important to stay up to date with our vaccinations. We can see that our complete series is steadily increasing across all age groups, but we still need to do some work with increasing our boosters. We also see that our case rates are lower this time of year compared to last year, and this is due to our increase in vaccinations overall. And to keep our cases at a low rate, we just need to continue reiterating the importance of boosters for all age groups. And now we're going to look at this dashboard for this school district information. And I believe Amanda is going to show that to you all.
Hello, good morning. So Emma, I'm gonna steal the screen.
Go for it.
And so I want to just direct everybody's attention to, hold on, let me share my screen first before I start talking. Okay, so this is, here, let me drop the link in the chat for you guys as well. This here is a dashboard that we have, which you've probably seen before. And so I was just recently kind of looking at this. And so this is our landing page. It shows some different reports. It has a link to ADHS's main dashboard for COVID, some other daily, like 2-week case maps that our GIS department in the county produces. But what I want to bring your attention to today are these two dashboards that you may be very familiar with. So that's the Pima County case dashboard and then the Pima County vaccine dashboard for COVID. And so I gave you the link here because it made more sense, but we're going to look at them individually. So what you may not realize is that on, let's bring this one into view, on the bottom of both of these, we have a toggle that says school district. So you can look at this on so many different layers, as we call them, different polygons making up Pima County and how that's broken down into different sections. So those are called layers. So we have a school district layer here on the bottom that takes into account COVID cases, and it breaks it down by school district. And there's a table on this side here that you can sift through and kind of look and see where your district ranks, not ranks, but is here in the list with the numbers. It's just going in order of count. And then on the right side, we have some more demographic columns and different things. And then there's an interactive map in the middle that you can click on, and it'll tell you the case information for that particular district. Alternatively, we have this available for vaccines as well, which is also on that link. So we'll look at that one. And this table that Emma just showed for the vaccine rates by district came from this dashboard. So that is all detailed right here. And I just wasn't sure. I mean, this has been this way for a while, and I'm sorry if we haven't communicated this out to you before that this existed, but I just kind of had this like duh moment on it while we were putting this presentation together. I just wanted to make sure y'all knew that this source existed, so you don't have to wait for us to show up to talk about case rates or vaccine rates in school districts. If you're curious, you can just pop on here and look at this. I believe they update this every 2 weeks. And then that down here, it says the last time it was updated. So we're getting close to an update. Yeah, that's what all I really wanted to share. And then I also wanted to share this. So we just did this week's COVID report, and we are now at 56 cases per 100,000 in Pima County. So we're getting better, but just as Emma had pointed out, you know, it's good to stay vigilant with the boosters, because what happens to us every January, as we can see here, 2021 January, and then this past January, we get these winter pop-offs. The vaccines are keeping the hospital systems in check, keeping the stress off of them and keeping the deaths down, but we still want to try to protect those kiddos as much as possible. So if you can get the messaging out there about boosters, that will help everybody try to have a nice winter season this year, and not come out of that Christmas break with another crisis on our hands. So good work everybody's doing, and thanks for letting us have your ear for a few minutes. Thanks.
All right. Thank you, Amanda and Emma. It's very helpful. Always appreciate having you on the call to explain a little bit about these numbers that we're seeing. So if you have any questions for Emma or Amanda, continue to ask those in the chat. But I would like to turn it over to Anissa from our epidemiology team to talk just really briefly about where we are with monkeypox.
Good morning, everybody. So I'm going to talk a little bit about where we are today. So with our cases for monkeypox, luckily in Pima County, we have not had any pediatric cases. Now, that's not to say that we may not in the future, which is why we've been working with Matt and the schools team and our epidemiology program on developing some talking points. I've been working especially with the TUSD school district, who's been very proactive in trying to get a protocol down in terms of when to report to Pima County, what to do. So essentially what would happen is if there was a suspect case, where the school or a parent called in and said, you know, this is what I think it is or not. We just want to send like with anything else, right? We want to send the child home to be evaluated by their provider. If it's determined that it's ruled out, like say it's hand, foot, and mouth disease, which is very common, a lot of the other, you know, parvoviruses, measles, rubella, anything like that, we have protocols for those already. So we would follow that accordingly. If it were a situation where we in the epidemiology department found out that it was monkeypox based on our case investigation, we have our isolation guidelines and protocols for the individual. We would notify and work with the school nurse to identify anybody that may have had close contact. Again, we go by transmission. It's not transmitted in the same way that, say, COVID is, right? Or influenza or norovirus. They're very different diseases. So we would work with them on doing our investigation and determining who would need to be notified as far as the parents are concerned. We have developed a parent notification letter. So that will be sent out to the schools, and we want to work with the schools directly on when it's appropriate and to whom to send that out to. So if there's any questions about that, I can answer those questions, but we wanted to give you a heads up that we are working on that. And like I said, we're trying to be proactive about that. I know it's a concern for people. So, thank you.
Thank you, Anissa. Just for clarification, is this letter to be shared with schools on a case-by-case basis if and when we were to see a potential case in a school? Or are we sending this out as a resource that they can have on hand now?
That's a great question. So we'd like to have it sent out as a case-by-case situation. Now, if some schools are developing their own and we're working with them, that's fine. That'll probably be the ultimate decision of Dr. Cullen. However, we want it to be where it's determined to be a probable or confirmed case. So we wouldn't send out the letter for any kind of suspect situation at all. It would have to be confirmed by the health department or a probable case, which that's just a lab, definition. So that's indistinguishable by the schools. It's more of a, CDC kind of determination, but essentially is we really want to do a good and thorough investigation before we notify people of a potential case, just because of implications that it could have if it turned out not to be. So we're very thorough in our investigations, but we would be working directly with the school nurse. So for instance, like I mentioned, I'm working with TUSD and Kathy's team on developing something on a protocol on what to do. And they have a really nice, plan in place that I'm sure they'll share later on when we get that finalized. And I think I encourage all the schools to do this with other illnesses as well. We're starting again into the fall season. And again, the things that we're going to see the most are going to be COVID, flu, and norovirus. And we know how those things spread. It's very, very different than a monkeypox situation. And then also because people are starting to be a little bit more lax in vaccines in general, what I'm seeing is I'm working up a lot of rule out cases for measles, which is very scary, right? But we've got a lot of hand, foot, and mouth disease in the community. So I really want to bring attention to those things that, to encourage your parents to take their children to their providers and get a really good diagnosis, get really good information on their illness, good testing. And you can always call us at the health department if you have questions about that on what to do. So I just wanted to put that out there. I know we're talking about monkeypox, but there's a lot of other things circulating that we're going to see more of, to be honest.
Matt, this is Kathy from TUSD. The reason we were looking at a letter was basically to have it'd be similar to what we send out for norovirus, or if we have cases that we need to let people know that we have a communicable disease. And we wanted to make sure that there was a template and that it was translated. So in the unlikely event we would ever need it, everybody wasn't scrambling to get it written and translated. So basically it's like an umbrella. We hope we have it and never use it. But I think if that it helps explain also, I don't think it would not go out for potential. It's just if in the unlikely event we need it, that it's already there, it's translated, and it's ready to go.
Absolutely. Yes. Thank you, Kathy. And if anyone else here would like help from the health department, support in creating a plan and protocol, we're just trying to be prepared and help schools prepare. It continues to be rare, and kids and youth continue to be low at risk for monkeypox. We just want to put measures in place just in case. And so if you'd like the support from the health department in creating a plan for your school, let us know. We'd be happy to help. All right, so that pretty much brings it to the end of our time today. If you have any questions that come up between now and next Thursday, feel free to shoot us a message at schoolsupport@pima.gov. And with that, I will just wish everybody a wonderful rest of the week. Thanks for joining us today. Take care.